Next up is Shahed Alam. Shahed is the co-founder and president of Noora Health. His presentation is titled Supporting Health at Home, Implementing a Rapid Learning-Driven COVID-19 Health Facility and Community Training Program. Shahed.
Thanks so much, and good afternoon, everyone. So since March 25th, and after the Prime Minister of India initiated a countrywide lockdown of 1.3 billion people, hundreds of millions of people became aware of COVID-19 and began to feel its impact, especially those in low-resourced communities. Now, imagine you're a person in this community. One day, someone in your household has flu-like symptoms. You're not sure if it's signs of COVID, so you look to the local clinic for support. It's closed, transportation's limited, and your neighbor said that the hospital is actually a dangerous place to go right now. How do you know what to do for your loved one? How do you know where to go, and how do you know how to keep yourself safe? From the beginning of the pandemic, we were committed to be there for these communities, patients, and caregivers so that they have the confidence that they need to support the ones that they love. At Noora Health, our COVID-19 response really stems from our learnings of scaling a family caregiver training program across more than 150 hospitals in India and Bangladesh. And central to our response is a rapid research and a needs-finding assessment today. Next slide, please. This research was conducted across 4 states in India beginning in mid-March, and we interviewed more than 5,000 individuals and conducted more than 100 qualitative interviews. And this was to understand the knowledge, risk perceptions, and practice of preventive behaviors. And what we initially found was that basically all of our respondents from the very beginning understood what COVID-19 was, and they understood it was important at least. However, given this, what we found about risk perceptions was very surprising. And over the past 2 months, the vast majority of people do not feel that they themselves or their communities are at risk of getting COVID-19. But even early on, what we found was that people actually felt that they had received enough information about COVID-19. Next slide, please. And what else we found was that what remained steady over the last 2 months was the low performance of the most critical preventive behaviors that people needed to be practicing at home. And when we really dug deeper about why, most were just not simply able to recall the specific steps that they were supposed to do to prevent the infection at home. And so with all of this data in mind, we launched our COVID response. Next slide, please. The primary objective of our response is to drive positive behavior change and adoption and retention in as many at-risk communities as quickly as possible. And our model of behavior change really rests on 3 key components. The first element is really about designing well-designed content that is comprehensive. We found from our research that people felt that they were getting enough information, but they weren't getting the right information, they weren't getting comprehensive information or contextualized information. So we worked hard to do that as quickly as possible. Next, we partnered with the government and more than 35 organizations to train and upskill their frontline staff. And these care workers to frontline workers in grassroots nonprofits. And we really chose these organizations because they're the people that communities turn to for support during this crisis. And finally, we leveraged the same digital tools like WhatsApp that was actually the source of a lot of misinformation, and we turned it into a tool for empowerment and support. So over the last 2 months, our strategy has evolved a lot as well. We began with focusing on equipping people with skills for prevention, but now our focus is actually a lot on empowering family caregivers of COVID-19 suspected or positive cases to heal better at home. And we are launching this service, which is a phone-based training initiative in partnership with the government. And we really believe that this is an incredibly important step in the right direction to allow people to heal safely at home and also to protect healthcare workers and resources in the region. Finally, with India passing Italy last week in the number of cases and cases rapidly rising in Bangladesh as well, we really have only started our work. But we do really believe in the power of family to heal. Thank you so much.
Thank you, Shahed. Questions are pouring in, so I'm just going to have to triage, and some of these will come to you later. The first one is, how are you adapting the interventions that you have created as you learn from your research?
Sure. It's also a bit about, you know, the questions we're asking in the research itself. We are adapting our tools pretty consistently based off of, you know, generally the trends that are happening around us. Initially, we really looked at the basic preventive behaviors, what was going on in terms of hand washing, physical distancing, masks, but then began to be more nuanced in terms of trying to understand what was happening with high risk groups, what was happening in terms of access to care. And the evolution of our tool and the type of data we're collecting is able to basically give that targeted information. What we're doing now is actually being very targeted with our actual population that we're targeting, and we're partnering with specific departments in the government to get access to those vulnerable populations. And so we're adapting our tools to collect data in that way.
Okay, I'm going to have to triage and I get to pick the question here. Were you able to see how COVID changed people's perceptions about the health system? And are those perceptions going to stick or degrade?
Right. That's a really great question. I think what we did find is that because the government had a very swift response from the beginning with the nationwide lockdown, and really all of COVID care being managed within the public health system, it did push a lot of people to engage for the first time with the public health system, which they may not have otherwise. And for the most part, especially in many of the municipal levels, that care has been provided well, and that experience, for the most part, can be described as well. And so, I think it has given a boost to the public health system in that way, and the perception there. But I think, as again, the challenge really right now is as cases are growing, the system is just becoming way more constrained. And in places like Mumbai, which are really hotbeds of this, it's really difficult to find and coordinate a bed. And what we see is, call centers are not being able to handle the volume of calls that are coming in. And just some of the basic systems that were working earlier on are breaking down. So I think, how we mitigate these things are really going to determine the future of this disease.
Yep. Multiple intersecting threads. Thank you, Shahed.